Good afternoon, everyone. My name is Luke Tannen, and I'm the Executive Director of Chicago Innovation, an organization that educates, connects, and celebrates innovative organizations throughout the Chicago region, large and small, through a variety of events and programs. We are also a very proud partner and customer of Wintrust. And today we have a great guest leading today's session called Should I Stay or Should I Go?, in which our speaker will be sharing how her organization provides critical, helpful, convenient, and free resources to people in need of senior housing, assisted living, and elder care solutions. But before we bring on our guest, it is my pleasure to introduce Wendy Schenker, the Chief Entertainment Officer and Vice President at Wintrust. One of Wendy's responsibilities includes managing Platinum Adventures, which, as many of you here know, is a travel and activity club for people aged 50 plus. So with that, please welcome Wendy Schenker.
Thank you, Luke. I'd like to welcome you all to our 7th in a series of monthly Platinum Adventure virtual events. We hope that you've enjoyed our monthly email newsletters, our activity sheets, sweepstakes, and our quarterly printed newsletter. We hope you've had a chance to join us for some of our in-person, in-bank presentations and our out-of-the-bank outings. As each month goes by, we are adding gatherings and outings for you. We have some great events coming up for the rest of this summer and for the fall. In addition, our extended trips program resumed this month with our mystery trip, and we've got a lot of wonderful destinations planned for later this year and into 2022. Be sure to reach out to your local Platinum Adventures director for more information on our events and our extended trips. I'd like to take a poll question now. Paul, can you post the question? Once you see the question on your screen, please answer it. I'd like to see how many of you are current members of Platinum Adventures. So just click yes or no, or if you're not sure, then click I'm not sure. And we'll give everybody just a few seconds to do that. And then we'll see who's in our audience today. Hopefully a lot of you are members, but if you're not, we can't wait to tell you about our club and have you join us. All right, so the majority are members. So 47% are members, 30% are not, and 23% of you aren't sure. So for those of you that aren't sure if you're a member, please contact your local Wintrust Community Bank, and a banker or our Platinum Adventures director can check on this for you. And for those of you who are not members, please, we'd love to have you join our club. And I'd like to say thank you to all of our customers. It's our pleasure to help you with your financial needs and to add some fun in your life through our Platinum Adventures program. Now on with today's presentation. Our presenter today is Gail Nixick from Elderwerks. Gail joined Elderwerks as a senior care consultant with more than 20 years experience in the sales and marketing of senior living communities, from independent retirement properties to skilled nursing homes. She has worked as a director of business development for a national home care management agency, and she was a co-facilitator at an Alzheimer's disease support group at Northwestern Medical Center. Gail has developed many community-based education and resource events that help adult children finding resources for elderly parents. With her extensive network of professional healthcare relationships, Gail brings her own passion and dedication to seniors and their well-being. Gail possesses the professional standards and compassion needed to facilitate the needs of seniors and their families while maintaining their dignity with minimal stress. So, without further ado, I'd like to introduce Gail and our program called Should I Stay or Should I Go? Gail?
Thank you so much, Wendy. I appreciate the kind introduction. Okay, so we have gone around and about this title of the presentation, and we're glad there's such an interest today in whether or not you should stay or should you go. So that can mean many of things to everybody. So just a little bit about Elderwerks and what we do and how we do it. So we provide senior living coordination, referrals, and guidance. So that could include the following: anything from home care, any other support services, federal benefits, local benefits, connections to other helpful professionals as you're managing this journey, elder law attorneys, trust officers, geriatric care managers, money managers, and other patient advocates, realtors, and a lot of veterans organizations. advocacy programs for either isolated or income restricted older adults, professional earnings, continuing education units, and those typically are for nurses, social workers, licensed nursing home administrators. We provide a vast amount of education throughout the year. Obviously, we've been doing everything virtually this year, and we hope to get back in person shortly. Our education, again, is also for not only professionals, but older adults, children, and caretakers. So today in our discussion, we're going to be talking about the challenging concerns. And also, I should say that there's so many concerns. So you really want to consider a lot of the health requirements. It just is really helpful to know about the things and what there are for the way of living and care options. I'm going to stop my video. The legal aspects of aging, how to decide, and then also some of the local resources for this support. It's not so much, about not listening. It's all about planning. I always like to say it's really important to be proactive rather than reactive. But a lot of these things are, having discussions are very important, but a lot of things that have brought up people to say, I'm not interested at this time. So if anything, just kind of put this in the back of your mind, just saying, I think I heard about this, something to know, something to learn, something to get more information about in the future. It could be next week, it could be next month, it could be many months out from now. So what are some of the benefits of planning? Well, obviously, if you're maintaining control, you are aware of all the options, and there's many new choices. And when I say many, there are such an amount of new options in terms of whether it is home-based or if it is options transitioning somewhere. But the whole idea is, I would advise, is stay calm. You can certainly avoid all of that chaos and then live the best of your life. So should I stay, some of the challenges and concerns are this, I would say that probably the most common scenario is people call us and ask us and talk to us about the safety, such as, an adult child might live here, mom or dad is somewhere out of state, and they're really concerned about the safety of them. So it's a matter of who is going to be acceptance of that help, whether it is in their own home or if they were to transition somewhere. There actually is, a lot of companies out there that will provide home maintenance, especially for seniors. More and more of those organizations are around. I would say the best resource for that are a lot of the townships. They have, they just call it a home maintenance service handyman for seniors. Affordability, people are always wanting to know how much everything is, what kind of support. Other challenges are the isolation, and then a lot, unfortunately, about financial exploitation. That's sad, but we have seen so much of it, unfortunately. And again, if people reach out, we'll certainly be able to direct them to the right resource for that. Elder abuse, and that can occur many ways, whether it's verbal or physical abuse, and happiness. So the question is, so why move? Size and security is definitely a consideration. The support that you get, in terms of with the spouse, some of the signs in terms of all of a sudden there's some recent falls, perhaps driving is not as easy as it used to be, and then just changes in health in general. Socialization. Honestly, I just think the socialization piece is so great. Just know that when people are considering a move, when they're moving to a community that is independent, and a retirement community, or a continuing care retirement community is called, the socialization is great. It's just like meeting new people, they're in finding out what their interests are, but at least you're in one community and hopefully making new friends in this next chapter of your life. Also, it's services that are on site at the community. So it's really a small little campus that don't have to go outside the community to get services. And it just really will simplify people's life. So here are some of the options. As I started, just to say that if someone is going to remain in their home, which we advocate for whatever's best for the older adult. So you can get in-home care. Again, the safety is the most important thing. And if it's going to work for everybody, sometimes, it doesn't work. Then there's those senior communities, and typically those are 55 and older. There's also some temporary assistance, rehabilitation, or respite. Respite is something also what we call a short-term stay, and I will also go into that a little bit more. Then there's comfort care, palliative care, and hospice care, these are available wherever the older adult lives, whether it is in their own home or if it's in a community. So as I mentioned, the specialized senior living is the retirement living. It's an active adult living. Then there's independent living, assisted living, and something called supportive living, memory care, Alzheimer's care, and then what I just mentioned before, entire community, which is continuing care retirement communities. There's also group homes, sheltered care, respite, skilled nursing facilities. So respite and adult daycare. So respite is a really nice idea for several different situations. So for example, let's say that you are considering multiple places to possibly move to. You can do a respite stay in that community. Think of it as like a little staycation, vacation somewhere where you just bring your suitcase and you go to a community, I would say typically for 30 days or so. And what this will allow you to do is really get a good idea if the community is a good fit for you. There's no obligation. So that means that, again, you just bring your own belongings, you stay, you enjoy all the activities. There's so many programs within a community, but you're just staying there for roughly, I would say, a good time to determine whether a respite is a good fit for you is about 30 days. I think that's when you get a good feel for what it's all about. Also, sometimes a respite actually can be a situation where if you have a family, if your spouse, someone might be having some surgery or something like that, and maybe you're the caregiver, it's also a good opportunity for that person to go there and do some additional rehab, but just stay when there's more care needed. Adult day is also a good solution when they're staying at home. It kind of gives you some time for you and get some relief while the other individual goes to a program, which they'll pick that individual up, and they also get so much ongoing socialization and support. The adult daycares they usually I think they cap them maybe at 25 to 30 people at best, just to make sure they're getting the socialization and support that they need at adult day. We do have all those resources available. That's probably one of the top questions we have about what adult daycare is available in the area. Hospice and palliative care. The goal for both is really comfort. It's pain management. It's usually a serious illness. It's also available 24 hours a day, 7 days a week, covered by Medicare, Medicaid, Veterans Assistance, and most private insurance. It does improve the quality of life for remaining time. It attends to the emotional and spiritual needs, and that really is inclusive of everybody. I cannot tell you, it really does take a village for something like this, and they do an exceptional job. We get so many comments about how wonderful it has been for the families involved, and they are so appreciative for all of theirs. Includes the doctors. The team is doctors, nurses, social workers, CNAs, and certainly chaplains and other volunteers. Volunteers actually really can make make it. And I know several people who do some volunteer work with the hospice. Palliative care, so how can you receive care? It's at any age, any stage, and it manages both the serious and complex illnesses. And it is really seeking relief from pain symptoms, chronic conditions. It can be an interim step to or from hospice. Also should know that it does help understand and manage the disease and the diagnosis. It's also assistance in navigating healthcare system. Curative treatments are allowed. Palliative care doctors, nurse practitioners, and social workers. It is covered by Medicare, and that's Part B, Medicaid, and most private insurance. When you're looking for places, kind of maximize on the dignity, autonomy, and the privacy, independence, choice, and safety that encourage community and family involvement. This is a decision for everybody involved. I just think that when people are looking at the next stage and chapter in their life, take the time and think about what's really important. It's quite a bit to uproot just about anybody at any age, but consider these things. You also want to make the decision sooner rather than later. It just allows, for a much better choice of an independence. We encourage independence, and it's all about the choices that are out there. And socialization is really just as important as exercise. And personality is a huge part of choosing a new lifestyle. You can do all your research and everything, but it's really all about when you are looking and considering places, look around when you're actually there touring places and see what the personality is of the community, because you can pretty much get a good idea and feel when you're walking around, you're seeing the residents. Hopefully they're all happy and vibrant, but even interview people that happen to live there. Say, hey, can you give me an idea, how long you've lived there, tell me what some of the pluses are, what do you like best about it? That's what I would say it's most important, but it is a big decision. It's a new lifestyle, and it is definitely a change. So, how can I stay home longer? Again, I can't emphasize the most important piece, which is safety. So when you are looking at options, there are also companies that will come out and do safety assessments. And we have those resources for you if you are interested, of course. But, the most important thing is they'll come in the home, they say, oh, let's say, they see some rugs in there that are just loose, those are just, not appropriate for someone that is having some mobility issues. So you can get a lot of the things to keep in your own home from Lending Closet. There's a lot of mobility aids out there. The power lift chairs are becoming more popular. It actually can reduce a lot of the expenses that are attached to cost of care in general. So there's a lot of research on that and availability. So we can share additional information on that. And there's something called home sharing. Some of the townships have that, not a lot, but some. So essentially what that simply is, for example, if somebody has their own home, they have a change, they don't have another, spouse living there, and they have a room to share. They actually can they kind of interview an applicant, another older adult that can share the expense that they have of their monthly mortgage and things like that. But they pretty much match the seniors to each other. Again, there's not a lot of it out there, but it's really also helped for the socialization piece. So that is something that is available. And then of course there is a reverse mortgage. So again, going back to the considering a senior community, if someone is experiencing some situations with balance, they're living in a home that has some multiple levels, you might need some additional assistance with what we call the activities of daily living. So since you are experiencing some of those, it might be time to consider that. Also, the suggestion of socialization. And also, would assisted living reduce a lot of stress for the family because they're constantly on the phone, talking to their parents saying, well, were you able to take your medication today? Do you have enough groceries? Is everything working in your home? So, and also there's been maybe a preliminary conversation with the physician recommending assisted living. So I would say that, those are some tell signs of time to consider a senior community. Also, is their mental and physical health suffering? And you can certainly tell, about when someone is not eating properly or regularly. One of the things, unfortunately, that, they have good intentions to eat something they put in the refrigerator. It's meat that it stays in the refrigerator for past the time that you are to use it by. That's really no longer a safe place for someone that's not able to prepare their meals and finding out they're not checking all the dates to use their food. Okay, how to decide? Again, it's all about the care needs, whether you're optimistic and realistic. Budget is really going to say it all, in terms of, the assets will determine the affordability. I always like to say about the budget and the affordability piece about it. So what you're looking at is, if you are living in a home, you still have costs attached to maintaining your home. And if you were to do a comparison of what it costs in terms of maintaining your home on a monthly basis, you then look at a community, say, what is it going to cost me to live here? And sometimes you find out that there is a savings. I mean, not always, but it certainly can be a savings because, remember, you are not preparing your meals anymore. You're not paying for your electricity or any other utilities, lawn maintenance, and so many other things like that. And also, location. You want to be near family and friends. And less important is maybe the amenities. So it is a good idea just to do an exploratory tour and see what they're all about. Lots of times there's some new communities. You probably have gotten some mailings, if you're in their zip code of a new community. I would encourage, you to take a look, take some notes. What do you like about it? What didn't appeal to you? This way you have some options. So for when the time is and you're able to make that decision, you personally have all of those notes about what you liked. But I would say probably the most important part is whether you want to be close to your family. A lot of people mostly want to be close to their doctors. Those are a lot of considerations. So how are you going to pay for the care going forward, moving to a community? You certainly can pay for it with personal funds, personal assets, reverse mortgage, long-term care insurance, veterans aid and attendance, and Medicaid. Just briefly on veterans aid and attendance benefit, which is an ideal benefit out there. A lot of people don't know about its existence. It's been around for a very, very long time. It's kind of tricky, it's a lot of information, but there's a lot of help out there in terms of applying for that benefit. And if someone served during wartime, they are probably eligible for it in the event they need care, whether it's in their home or if they were to move to a community. And that is available to the veteran or the surviving spouse. Some of the things to consider about the legal aspects, decisional capacity, you're starting to hear some things that maybe that's a little bit alarming to you because you say, oh, I spoke to my mom or dad and you're not sure you're getting the full story. Or even if you ask them a simple question, what do you have for breakfast? And you're still not able to get some simple answers. There might be some tell signs about that as well. They're probably, saying to you everything is great, but sometimes things aren't how they appear to be. And especially on the phone, you're not able to get that exact scenario of what might be going on at their home. So also POA, the power of attorneys for healthcare and property, those are really important. We encourage that. Most of the people that I talk to, the professionals will say, as soon as your kids go off to college, boy, probably a good idea to get those power of attorneys in place. Advanced directives, living will, trust, irrevocable and revocable special needs, and then guardianship. Guardianship, unfortunately, is something that hopefully most people should avoid. It's what they call the last resort. If someone is not able to make a decision on their behalf in their best interest, then someone else might be appointed for guardianship. But guardianship not only appears for older adults, guardianship, might appear for someone who might be disabled, and they do need guardianship takes place on that. But lots of times people don't realize that, the conversations are taking place and they're realizing that someone is resistant, and there's not a good outcome, and they've really exhausted all measures of trying to find out, making sure this person could get the help, and they need the help. They desperately need the help, whether, again, if it's in their own home or transitioning to a community. Ultimately, guardianship might be the only solution. And a lot of the professionals will help you and ease your burden with this. And how they do that, the social workers, of course, that if there is a recent hospitalization, they are found in the hospital or maybe a care community. And they're also covered by insurance and part of the support team. There's more support out there than people think there are. And we love to connect everybody with other support services out there. A therapist is usually covered by insurance, and that's anywhere between 80 and 100%. There's something called a patient advocate and private pay. And a patient advocate can be used in many ways. So let's say there is a hospitalization and there isn't any family member, and they are really, really having a difficult time in terms of trying to figure out, what is happening with the insurance. A patient advocate could step in and help them and be that conduit between them and the insurance, and making sure everything runs smoothly. Also, it does improve communications and care. The patient advocate, just like maybe a geriatric care manager, is either a social worker or an RN, but they are there solely for the benefit of the patient and helping them with whatever situation might be going on. It might be a one-time and it might be continuous. The geriatric care manager is ideal for a customized care plan. They can really help facilitate so many other services. So if someone were to have a recent hospitalization, they're going home, they really need some additional help. So I look at it as a project manager, someone who's really going to help and follow the patient once they go home, especially if they don't have, someone to oversee their continuous care. And someone I know is a geriatric care manager, to coin her phrase, she goes, I'm like an extra daughter for this person. They also provide and give you referrals for doctors and other transport, and sometimes there's translation involved. A daily money manager. So someone who's no longer able to keep up with bill paying, and that's just too much of a burden from them, you can certainly utilize the services of a daily money manager. The decisions, again, are you able to live independently in your current residence? Asking yourself the other question, do you feel safe? And some people have told me they just don't feel safe anymore. They're getting older, they're getting more vulnerable. As you know, there's unfortunately a lot of calls and a lot of scams, and it can happen to anybody. Are you able to maintain being social? Let's talk about budget. Anytime you plan and think about a budget, it's going to be helpful for the next step of what your considerations are. I do feel that based on a budget, once you know it, there are a lot of options. I mean, there truly are. And it's a matter of, okay, so I'm in this area, but if I could get more for this amount of money, I would consider looking outside my comfort area of where I'm at right now. Do you want to be, do you want to do more? Do you want to be more active? Yeah, I would think anyone does, there's just so much to do. I visit now, I'm fortunately back visiting these communities, and I see how active people are. And, there's nothing just more satisfying than walking in and seeing a nice, a music group going on, some singing. I mean, it's a feel good situation. So, again, these are decisions, and ask yourself, what's important to you about these considerations about moving. So you just want to kind of ask, there are so many different things going on, the support is ongoing, and it can be still actually can be virtual. Again, there's all the help at home. I mentioned a lot of the day centers and activities, the care services, the respite, and there are a lot of people that are. We've heard, from people saying there's some younger individuals with dementia. What kind of programs are out there? Is it too early to start looking, for a community? We would also encourage individuals to start taking advantage of all the education out there for individuals with dementia. The Alzheimer's Association has a wonderful educational program. Every single month there is a talk on helping, the caregiver, someone asking for additional services, but, or if you're early in the journey about how to go about getting any other additional help. So the resources, the area on aging, that is funded by the federal and state of Illinois, the Department of Aging. They have a contract with the nonprofit agencies to help low-income families, Catholic Charities, Senior Service Associates. The program financial net limit is $17,500, which will help with daycare, congregate meals, senior centers, community care program. I just want to mention what the community care program is. If someone is seeking home care, non-medical in their home, they will qualify for the community care program. They're assigned a case manager. They would come out to the individual's home for that screening, and then they would assign a caregiver through an agency that they are contracted with. And usually the services are anywhere from 8 to, I think the maximum is they will about 20 hours a week. And then there's also the money follows the person program. The resources, there's so much on transportation out there. There's more. We are learning. There's so much more in transportation. We're so happy to hear that. The social services, the home upkeep programs, as I mentioned, people have lived in their homes for, gosh, sometimes it's anywhere from, oh gosh, it could be, 40, 50 years. And they go, oh, it's probably can use some help in here. There's also Meals on Wheels. There's the towns and the township, the village nurse. I'm always very fond of village nurse. They don't, not every single village does have it. It certainly depends on where you live. The police social workers, they do get very engaged and so involved with the older adults in the community. They really have the pulse on the seniors that either could be isolated, possibly neglected, but they are also a wealth of information. And I would absolutely encourage just calling the social workers from the police in your township and see what other resources they can provide. And then elder law attorneys. Most of the elder law attorneys that we know, they actually usually have a 30-minute consultation. So they're happy to answer a lot of simple questions. We do a lot of programs on some of the information, such as the power of attorneys, advanced directives. But on my next slide, if I haven't included it, there is an association for national elder law attorneys. If someone is looking for an elder law attorney, you can just put in your zip code, find it. It probably will give you, if you're looking for 10 miles or 20 miles. Sometimes people are looking for elder law attorneys out of state. NALA, the organization, is you can find any attorney that way. But the specialty is most important when you're dealing with older adults. You want an elder law attorney versus someone who does general practicing in terms of attorneys. You just want someone who is specialized in elder law. The other support services, there are so many. There's the Elderwerks, us, we can help you with all aspects of it. Our Elderwerks Senior Resource Directory is also available online, and it is also digital, so you can access the entire directory online. Like I said, if you're looking for adult daycare, if you're looking for transportation, if you're looking for some medical information, financial advisors, anything with government related and all the benefits. There's a very nice section in there, as I spoke about the Veterans Aid and Attendance benefit, that will explain it and what the procedure is and how one goes to apply for it. The local chambers, senior move managers. Some people aren't familiar pretty much with senior move managers, but what they do is they help facilitate the senior moving from their home to, again, the community of their choice. So they will come in and they will help with, okay, and this is what I would like to take with me. This is what I'd like to donate. This is what I would like to sell. Also help, with, if they know estate sale managers, they can help with that piece of it. Trust managers certainly will help with all of this. And any local organization that is going to support older adults. So some of the newer trends that we're seeing in terms of at senior communities, we are seeing that the food is exceptional. I mean, when you are going to a community and you're seeing the plated food, it is usually restaurant style. There's because it's important, you're eating it either 2 meals a day, possibly 3, and you really need to, go there and try the food out, see what it's all about. But they've really stepped up, in terms of food and made it really quite enticing. We're seeing more and more memory care communities, which is I'm very thankful of, because the memory care communities, they are what we call a social model. So maybe some people think that someone who has Alzheimer's goes directly to a nursing home. This is not accurate. Memory care communities are all social. They have their own apartment. They bring your own furniture. Then there's assisted living for life. The innovations that there are so many new innovations. Home sharing is getting more popular. And then the residential care homes, it's not as common in Illinois. They are probably more common in the West Coast. They actually started out there calling board and care. So what they are is an actual residence, and they might have up to maybe 8 residents that they care for in these residential care homes. And then there's the electronic communication, which is so neat, because now you can find out if the person is, taking their medication on daily. You can even do some of the vitals, but it's basically electronic charting, in your own home that you're able to keep up in the communication with. So they're stepping up their game with that. So communication is extremely important on the electronic side. Tomorrow is never promised. Remember, you only have one ride through life, so give it all, and enjoy the ride. And I thank you so much for your time. Do we have any questions?
Yes, thanks so much, Gail. This is Paul jumping in, and we do have a few questions that came in. So I'll start with this first one. For a 56-year-old female with ALS, is palliative care the best option? Is a doctor's recommendation required?
Well, first of all, and for any care, for palliative or hospice, a physician order is absolutely necessary. Without knowing any of the clinical, that is something I honestly cannot answer. They do have an exceptional clinical team at Les Turner ALS. I would ask that question to them. They have a nurse educator there as well. So that is the person I would ask the question to.
And the next question, if one is looking to downsize from a single family home to a 1 or 2 bedroom condo, should I start renting to avoid maintenance issues? And by the way, I do not have active lifestyle. I do have an active lifestyle and no disability.
Okay, so again, start renting. What was that part, Paul, about?
So looking to downsize from a single family home to a 1 or 2 bedroom condo, should I just start renting to avoid maintenance issues?
Well, that again, those are all personal choices. Anytime you rent, you don't have to take on the responsibility of anything. If you can reduce your costs that way, it might be a good idea.
And the next question, does Medicare cover hospice if the person is in an assisted living facility?
Yes. Hospice is covered wherever the individual is. So again, that's all Medicare and it is covered, correct?
And here's an easy one. Someone is asking if they can get a copy of the slides.
Yes.
Great. And then here's another question. Is your service for pay, and what is the pricing schedule?
No, our services are complimentary to for anybody. We are a resource. We do not charge any fee.
And another one, what are some examples of types of diagnoses that are covered in palliative care? Is advanced Alzheimer's covered?
I don't know. Those are very, very specific to the guidelines of Medicare. So they have certain scales in terms of when they do the evaluation of what's covered. So first, the first and most important thing is to get a palliative care consult, and they actually review and over that with you when they're doing the assessment.
Okay, and this next question is from Dale, and he is asking, my aunt is in a senior center. I'm getting some bills from a nurse practitioner, but did not authorize the visit. Do I need to pay these?
No. If you are the power of attorney and you had no knowledge of those invoices, you absolutely are in no obligation. And ask that person for documentation of where and who authorized those visits.
All right, and lastly, someone is just asking if before we close here, if you're able to reshare your contact info.
Well, I guess I can. If it's okay with you, can we run the questions and then when I go back to it, I can put the contact information? Is that all right? Or can I put that in the chat? Which is your preference?
Well, I think either on the slide or in the chat would be great.
Okay, sure.
And-
After we go through the other questions, I'm happy to share that information.
Great. And yeah, there are a couple more questions that popped up here. Can you recommend assistance program for a special needs child?
I'd really need to know more information about that. Geographically, it's really important. My contact is information that if that person wants to reach out to me, I can address that individually.
And then Gloria is asking for clarification on what is comfort care.
Comfort care and palliative care are actually one of the same. It's another term for palliative care, keeping someone comfortable. Excuse me, sorry, Paul. Some people just call it comfort care.
Okay, thank you. And Dell has this question. How can I help my 92-year-old mom accept she needs care? She refuses to sell her home. She's had several falls and hospitalizations.
Right. Yeah, well, that's again, that a medical event usually triggers that trying to have that conversation, whether or not you can be successful with it or not. That just sounds like that person is being, resistant to accepting help. So that's when you want to enlist the help of others. So my suggestion is, depending on where, she lives, I would say probably getting someone in, such as a geriatric care manager that can do an assessment, just to have a brief conversation with the individual, come back to you and say, this is what we would recommend. But sometimes talking to a geriatric care manager directly to the older adult is a better scenario rather than a relative trying to talk the person into moving somewhere when they're going to be very resistant, they might be more accepting of a professional. And they, maybe by the end of the conversation, they're saying, well, maybe I do understand it. Maybe it is better for me to move. But it is really better to enlist the help of other people to help you. And it is, this is really so common that we get that situation where no one wants to move. They just think that they're not going to fall again. They don't think they're going to be hospitalized again. So I think the geriatric care manager is a really good start with that. Or the primary care physician if they have a scheduled visit there.
And speaking of a geriatric care manager, Rosemary is asking, where can you contact a patient advocate or geriatric care manager? Is this through a hospital or through some kind of directory?
There is an organization. I guess I can also put that in the chat, Aging Life Care Association. And what you want to do is go to that website where it says find a care manager. Again, you type in your zip code and you put in, 10, 20 miles from that zip code. Everybody who is part of this association is part of that, and you can just reach out to them. We also have a list of geriatric care managers if it's more helpful for you to reach out to us. But I would say the Aging Life Care Association, that way you can kind of read up about the person before you make a call to them. They're becoming more and more popular. Again, just like the patient advocate, they're going to be, sometimes it's necessary for that geriatric care manager or patient advocate to talk to the medical professionals at the hospital. And especially if the family is not in agreement about, what the discharge plan is, things like that. And if the geriatric care manager is a nurse, they usually, they talk their language. So it's much easier for the patient advocate or geriatric care manager to talk directly to the hospital. But they truly, really can help a lot with a lot of situations. So it's Aging Life Care Association.
All right, just a couple more questions here. The next one is, I'm planning on moving to another state to be closer to family. Can I get any help emptying my home and packing?
Yes, that we have certainly a resource for somebody to help downsize. Well, in this case, pack up, but same thing. We can certainly provide a resource for you for that.
And then Jim has a kind of a general question. He's just seeking some general advice regarding reverse mortgages. Is there anything you can touch on regarding that?
Not so much, to be honest with you. I do know that it definitely is a really good option when people want to stay in their home. If there's enough equity in the home, I would certainly, reach out to someone who works with reverse mortgages, who also can explain the benefits of it. But ideally, we do know that a lot of people reach out and tell us they have a reverse mortgage. They still are planning to move somewhere. But it's just like everything else, it doesn't necessarily work for everybody, but you want to consider some of the options, and it might be very beneficial for them.
And the last question I see here, it's from Karen. Is a home stair lift covered by insurance?
So if I'm trying to recall about that, I believe it is not. But what I will say about this stair lift is do your research on it. It is, there's a lot of options out there. I am told you can also get those as rented, so you don't have to go the full price for buying one. If you can rent one, that's great. And that will reduce the cost significantly.
Great, and that's all the questions that came in for right now, but I see you put your contact info up there if anyone else has any questions that were unanswered. So thank you very much, Gail. Appreciate it.
Oh, sure. My pleasure. Thank you so much for having me. Appreciate it.
Okay, well, thank you, Gail, for that interesting and educational presentation. And really thank you for participating in today's virtual event. So to the audience, if you enjoyed today's program, please tune into our next virtual event called Financial Preparation and Recovery, on August 18th. We look forward to seeing you soon in person or virtually. So until then, take care and thank you for tuning in. And back to you, Luke.
Great. Thank you, Wendy. And thank you to Wintrust for hosting this terrific Platinum Adventures program. And thank you again to Gail from Elderwerks and all the great work that you do and really providing some great and very helpful information today. Finally, I want to thank the Platinum Adventures audience for tuning in. And as Wendy mentioned, we have some more great Platinum Adventures events planned, and we hope to see you all again soon.